If you're over 50 and dealing with joint pain, I want to share something with you that might change how you think about this problem. For years, you've probably been told that joint pain is just part of getting older, that it's normal wear and tear, that you just have to live with it. But what if I told you that's not the complete picture? What if there are three specific vitamins that most Americans aren't getting enough of? Vitamins that can actually help repair damaged joints and reduce that constant ache you feel every morning? I'm not here to sell you anything. I'm not promoting any specific brand or product. I'm simply going to share what scientific research has shown about these three vitamins, why they matter so much for your joints, and, most importantly, how you can get them starting today. Because here's the thing, joint pain doesn't just hurt physically. It steals the simple joys of life. It makes playing with your grandchildren harder. It turns a walk around the block into a challenge. It can even rob you of a good night's sleep because you can't find a comfortable position. And that affects everything, your mood, your independence, your quality of life. So let's talk about real solutions, not quick fixes or miracle cures, but actual science-backed approaches that can make a measurable difference. The three vitamins I'm going to discuss today are vitamin K2, vitamin D, and vitamin C. Now, you might be thinking you've heard about some of these before, and you're probably right. But what most people don't understand is how these specific vitamins work together to protect and repair your joints, and more importantly, how to get the right forms and amounts of them. Let's start with the first one, vitamin K2. This is probably the least known of the three, and that's a shame because it plays an absolutely crucial role in joint health. Now, you might have heard of vitamin K before. Vitamin K1 is the one doctors talk about when discussing blood clotting. But K2 is different, and it does something remarkable for your joints. Think of vitamin K2 as a traffic controller for calcium in your body. Here's what happens. Calcium is essential for strong bones. We all know that. But calcium needs to end up in the right place, your bones. The problem is, without enough vitamin K2, calcium can start depositing in the wrong places, like your arteries and your joints. When calcium builds up in your joints, it causes something called calcification. This leads to stiffness, inflammation, and pain. It's one of the reasons why your joints feel so rigid in the morning or after sitting for a while. Vitamin K2 activates specific proteins in your body, proteins with names like osteocalcin and matrix GLA protein. These proteins grab onto calcium and direct it into your bones where it belongs, strengthening your bone density and reducing your risk of osteoporosis. At the same time, these proteins prevent calcium from accumulating in your joint tissues and blood vessels. Research has shown that people who are deficient in vitamin K2 have a significantly higher risk of joint calcification and arterial stiffness. One study found that adequate vitamin K2 intake was associated with a 40% reduction in severe arterial calcification. And since your joints work in a similar way, getting enough K2 can help keep them flexible and pain-free. So, where do you get vitamin K2? The best natural sources are fermented foods. Aged cheeses, especially Gouda and Brie, are excellent sources. Sauerkraut and other fermented vegetables contain K2. There's also a Japanese food called natto, which is fermented soybeans, and it has the highest concentration of K2 of any food. Now, I'll be honest, natto is an acquired taste, and most Americans aren't used to it. But if you can handle it, it's incredibly beneficial. For most people, eating aged cheese a few times a week or taking a K2 supplement is the practical approach. When it comes to supplements, look for the MK7 form of K2, which stays in your body longer and is more effective. Most doctors recommend between 100 and 200 micrograms daily. One important note here, if you're taking blood-thinning medications like warfarin, you need to talk to your doctor before supplementing with any form of vitamin K. because it can interfere with how these medications work. Now, let's move to the second vitamin, and this one you've definitely heard of. Vitamin D, often called the sunshine vitamin. Most people know that vitamin D is important for bone health, but fewer understand just how critical it is for joint health and pain relief. Vitamin D deficiency is extremely common, especially in people over 50. Some estimates suggest that up to 40% of American adults don't have adequate vitamin D levels. And when you're deficient in vitamin D, your bones can become weaker, your joints can ache more, and inflammatory conditions like arthritis can get significantly worse. Here's how vitamin D helps your joints. First, it helps your body absorb calcium efficiently and incorporate it into your bones. Remember what we talked about with vitamin K2? Vitamin D works hand in hand with K2. While K2 directs calcium to the right places, vitamin D ensures you're absorbing enough calcium in the first place. Without adequate vitamin D, even if you're taking calcium supplements, your body can't use that calcium effectively. Second, vitamin D has powerful anti-inflammatory properties. Chronic inflammation is one of the main drivers of joint pain and damage. Vitamin D helps regulate your immune system and reduces excessive inflammation in your joints. Multiple studies have shown that people with low vitamin D levels report significantly more joint pain, especially in weight-bearing joints like the knees and hips. In one clinical trial, participants with chronic knee pain who took vitamin D supplements reported a noticeable reduction in pain levels after just 12 weeks. Another study found that maintaining optimal vitamin D levels was associated with slower progression of osteoarthritis. So how do you get enough vitamin D? The most natural way is through sun exposure. Your skin produces vitamin D when it's exposed to sunlight, specifically UVB rays. About 10 to 30 minutes of midday sun exposure several times a week is usually enough for most people, though this depends on your skin tone, where you live, and the time of year. People with darker skin need more sun exposure to produce the same amount of vitamin D. And if you live in northern states, especially during winter months, you're probably not getting enough sun to maintain adequate vitamin D levels. That's where diet and supplements come in. Fatty fish like salmon, mackerel, and sardines are excellent sources of vitamin D. Egg yolks contain some vitamin D as well. Many milk products and orange juices are fortified with vitamin D, though the amounts are usually modest. For most people over 50, supplementation is the most reliable way to maintain healthy vitamin D levels. The recommended daily amount varies, but many doctors suggest between 1,000 and 2,000 international units daily for adults. Some people need more, especially if they're deficient. The only way to know your vitamin D level for sure is through a blood test. Ask your doctor to check your 25-hydroxyvitamin D level. The optimal range is generally considered to be between 40 and 60 nanograms per milliliter, though some experts recommend even higher levels for people with joint problems. One more thing about vitamin D, it's a fat-soluble vitamin, which means it's absorbed better when taken with a meal that contains some fat. So take your vitamin D supplement with breakfast or lunch rather than on an empty stomach. Now, for the third vitamin, vitamin C. Everyone knows vitamin C is important for immune function, especially during cold and flu season. But what many people don't realize is that vitamin C is absolutely essential for maintaining healthy joints and repairing damaged cartilage. Here's why. Cartilage is the smooth, cushiony tissue that covers the ends of your bones, where they meet to form joints. It acts like a shock absorber, allowing your joints to move smoothly without bone grinding against bone. The main structural protein in cartilage is collagen, and vitamin C is essential for your body to produce collagen. Without adequate vitamin C, your body cannot make enough collagen, and your cartilage begins to break down. This leads to increased friction in your joints, which causes pain, inflammation, and further damage. It's a vicious cycle. Less collagen means more cartilage damage, which means more pain and stiffness. Vitamin C doesn't just help build new collagen, it also acts as a powerful antioxidant. Oxidative stress, which is damage caused by free radicals in your body, plays a major role in joint deterioration. Vitamin C neutralizes these free radicals and reduces inflammation in your joints. Research has consistently shown that people who consume adequate amounts of vitamin C have a lower risk of developing arthritis and experience less joint damage over time. One large study followed participants for over 10 years and found that those with the highest vitamin C intake had significantly less knee pain and were much less likely to develop osteoarthritis. Another study found that vitamin C supplementation helped reduce inflammation markers in people with rheumatoid arthritis. The good news is that vitamin C is relatively easy to get through diet. Citrus fruits like oranges, grapefruits, and lemons are famous for their vitamin C content. But they're not the only sources, or even the best sources. Red and yellow bell peppers actually contain more vitamin C per serving than most citrus fruits. A single red bell pepper can provide more than twice your daily vitamin C requirement. Broccoli is another excellent source, as are strawberries, kiwis, and Brussels sprouts. Tomatoes, both raw and cooked, provide vitamin C as well. For most people, eating a variety of fruits and vegetables throughout the day will provide plenty of vitamin C. However, there are some situations where supplementation might be helpful. Smokers, for example, need significantly more vitamin C because smoking depletes vitamin C levels in the body. People under high stress, those recovering from surgery, or anyone with chronic inflammation might benefit from extra vitamin C as well. If you do choose to supplement, most experts recommend between 500 and 1,000 milligrams daily for joint health. Vitamin C is water-soluble, which means your body doesn't store it, and any excess is simply excreted in your urine. This also means you need to consume vitamin C regularly, every day, to maintain adequate levels. Unlike vitamins K2 and D, you can't really build up stores of vitamin C in your body. One practical tip, if you're taking a higher dose vitamin C supplement, split it into 2 doses during the day rather than taking it all at once. This helps maintain more consistent blood levels throughout the day. Now, here's what I want you to understand. These 3 vitamins don't work in isolation. They work together synergistically. Vitamin D helps you absorb calcium. Vitamin K2 directs that calcium into your bones and keeps it out of your joints. Vitamin C builds the collagen structure that keeps your cartilage healthy. Together, they create a comprehensive approach to joint health that addresses multiple aspects of the problem. This is why getting all 3 vitamins is more effective than focusing on just one. Let me give you some realistic expectations. These are not overnight solutions. Joint damage takes years to develop, and healing takes time too. Most people who start addressing these vitamin deficiencies notice some improvement within 4 to 6 weeks. The stiffness might ease up first. You might find it easier to get out of bed in the morning or climb stairs. The actual pain reduction often takes a bit longer, usually 8 to 12 weeks, as your body gradually repairs damaged tissue and reduces chronic inflammation. Some people see dramatic improvements. Others see modest but meaningful changes. Everyone's situation is different, depending on how severe the joint damage is, what other health conditions are present, and how deficient they were in these vitamins to begin with. The important thing is consistency. Taking these vitamins sporadically won't give you results. You need to make them part of your daily routine, just like brushing your teeth. And remember, while these vitamins can make a significant difference, they work best as part of an overall approach to joint health. Maintaining a healthy weight reduces stress on your joints. Staying physically active, even if it's just gentle walking or swimming, keeps your joints flexible and strengthens the muscles that support them. Avoiding inflammatory foods like excess sugar and processed foods helps reduce overall inflammation in your body. Before I wrap this up, I want to address a concern some people have. Is it safe to take all three of these vitamins together? For the vast majority of people, yes, absolutely. These are nutrients your body needs anyway, and getting them through food is completely safe. Even when supplementing, these vitamins have excellent safety profiles when taken at recommended doses. However, as I mentioned earlier, if you're on blood thinners, you need to consult your doctor about vitamin K. And if you have any chronic health conditions or take multiple medications, it's always wise to discuss any new supplements with your healthcare provider. They can also test your vitamin D levels to see if you need a higher dose initially to correct a deficiency. If you found this information helpful, please take a moment to subscribe to the channel. It really helps us reach more people who are dealing with joint pain and looking for real solutions. And if you know someone who's struggling with joint issues, share this video with them. Sometimes the most valuable gift you can give someone is information that could improve their quality of life. Thanks for watching, and here's to healthier, happier joints.